下面演讲的题目呢是慢性疲劳综合症心脾两虚型的中医治疗思路，由汤淑兰教授来演讲。汤淑兰教授呢是1984年毕业于南京中医药大学中医系，并获得医学学士学位。1987年毕业于北京中医药大学方剂专业硕士学位，现任英国南中医学院院长，英国中医药中心主任，南京中医药大学欧洲校友会会长，南京中医药大学安徽中医药大学客座教授和博士生导师，北京中医药大学临床特聘专家，世界针灸学会联合会理事会执委，世界中药学会联合会理事会执委，全欧洲中药专家学会副会长，第2届海外国医大师，发表过70多篇学术论文，并主编和合作主编中医专著数部。慢性疲劳综合症是现在中医临床的常见病，是一种持续超过6个月、原因不明的疲劳为核心特征的复杂性病后。充分休息后，疲劳不能缓解，在新冠疫情之后，发病率显著增加，常伴有失眠、腹胀、抑郁、心脾两虚型尤为多见。中医传统治疗是以南宋时期的归脾汤为经典代表方，以温补心脾气血为主。然而，现在人们的体质相对于800多年前呢，多偏湿偏热。汤教授在中医临床治疗慢性疲劳综合症总结出多见心脾两虚兼气阴不足、肝郁不舒血，从而创立了丹少太子参法，以健脾益气、宁心安神、养阴如肝，效果非常满意。好，下面由汤教授上台演讲，欢迎汤教授。
非常感谢秀武得知的精彩介绍。在座的我们非常自豪，吕梅教授是我们南中医的第1代的博士生。我们秀武得知是我们南中医的第2代博士生，是我们英国南中医学院和南京中央大学在新时代培养的海外的中医博士生，从西班牙过来，非常感谢。今天呢，因为是这个国际学术讲座，我们前面的专家都用中文讲的，虽然 PPT 呢是这个 PPT 是这个双文的，下面呢我想以英文来讲这个经过到英国的这个说英文的常会者。Thank you everyone, and I'm so pleased to see you all here today. And the title of my talk is on the spleen. A Chinese medicine approach to treat the chronic fatigue syndrome. I'm going to talk this here. We often call this problem as CFS for short. I have worked as a TCM practitioner for 42 years, 35 of these years were here in Britain, in the UK. Today, I want to talk 2 things. First, I will show you how I understand and treat this problem, CFS. Second, I will share a new formula that I developed through my clinical practice over the many years. So, what is the CFS? It is a very deep tiredness. It lasts more than 6 months, and after rest does not make it better. This is a key point. Constantly, extremely tiredness. These patients often present with other symptoms as well: insomnia, low mood, emotional, low motivation, poor appetite, or poor concentration and memory. So this is after the COVID, we see this sort of patient group are more in our TCM clinics. Our colleagues have the same understanding that as well. So we see more and more patients in the complaint CFS, and often they off work and they can't go to work. They claim they benefit, give lots of pressure in the society as well. So the WHO now is listed CFS under the nervous system disease, and so it is a real serious problem. So in Western medicine, what caused the CFS is still not clear. So, and there is no universally effective treatment. Management is mainly supportive, helping patients pace their energy and rest well, or antidepressant or sleeping habits. So here, Chinese medicine has a real chance to help. Why? Because we do not treat a name, we look at the whole person. We ask, what is out of balance in this body? So in terms of TCM, the disease is this CFS. This CFS, there's wasn't really written in the TCM classic box, but according to my clinic observation and understanding, I found that CFS, the disease is located mainly in the heart, spleen, and liver. And the most common pattern is that heart and spleen deficiency. Heart and spleen deficiency. So the patients typically present with chronic fatigue, palpitation, poor memory, disrupt the sleeping, and reduce the appetite or bloatedness, or aching muscles and weakness of limbs. So for this pattern, we have a classical formula called Guipsi Tang, Guipsi wine, Guipsi detoxin. This is a very famous prescription. Most of TCM practitioners would use it. It is warmly tonifies the heart, and the spleen, chi, and the blood, and nourish the heart to calm the brain, to help the sleeping, and also it's very good for immunic, for red blood cell. But this is my main point today. There is a still problem, although this is a very famous prescription. The problem is this formula is about 800 years old. Think about that. This is created in the Song Dynasty, South Song Dynasty. 800 years ago, how did people live? There's so much different from nowadays. Land was high, food was scarce, and a lot of people are mainly dealing with the physical labors was very heavy. there's no cars, no phones, everything's badly need out the physical energy. So most of the body constitution were deficiency and cold. For such a body constitution, so therefore warming and tonifying was exactly appropriate, and the formula suited very well Whipsy Tang. This is good if the CFS due to the heart and spleen deficiency due to the cold body constitution. But now think about our patients today. We eat too much, often eat too much and high energy food. We sit a lot, still sit and carry a lot of stress and worries. So that the modern body constitution can change over the years. Today, many patients present with internal heat together with liver qi stagnation, and long-term liver qi stagnation can cause the liver and heart failure. So they can cause the liver and heart failure. So Whipsy Tang is like it's been too warm. So in my clinic, I observed this repeatedly. When Whipsy decoction is used alone, the response is often not as satisfying. In some cases, it might aggravate the heat. They might get more headache or thirsty or sore throat or nose bleeding, and the patients become more dry and more irritable because warm up. They actually their tiredness is not mainly due to the real deficiency or insufficiency of food or nutrient. So this finding comes from my own clinical experiences, from what I observed in my patients over the 35 years. So over many years, I made a clinical observation. Yes, the patients have a heart and spleen deficiency that might not really qi and blood deficiency. They can often see the qi and yin deficiency, and with liver qi stagnation. For example, if for Whipsy Tang they are tired, and the tongue can see pale and teeth mark and thin white coat. But how about the patient they showing red tongue and even with a lot of cracks on the tongue, there's no coating, or maybe very red lips, very dry, or especially for a menopausal woman, they have red cheeks and hot flashes and tiredness. So therefore, Whipsy Tang we need a modified bit to use. So to treat must address the three aspects to tonify without warming, excessive heat, and nourish the yin and soothe, tonify, nourish, and calm the liver and the heart and the mind. So I created a formula, I created this formula like in the morning, and Professor President Chen created a formula for treating cancer. And my formula, this is I created for treating the CFS. The name is 甘草太子参散. Its method is simple. 4 things: to tonify the qi, to calm the mind, nourish the yin, and soothe the liver. Here. Now let me show there's 2 prescriptions side by side, and look at the old formula and my formula. So we can tell, especially my brother, old brother, studying brother, Professor Perry, said he is the most expert set in front of me. So I think you may tell more than me, tell better than me, yeah? So this is what's thought about my formula is to tonify the qi to the classical formula. You use rinsing huang qi. The Whipsy Tang use rinsing huang qi. They are big qi tonic, but they are hot, they are warm in nature, can create the heat. But instead, I use TCM. It is mild in nature. It's tonified both qi and yin, gives the increased energy without generate cause excessive heat, cause too much thirsty or dryness. So this is, I think, is important for modern people's chronic fatigue. Next is for blood and the mind, I use dancing. Dancing instead of dangui. Dangui is pungent and warm, but dancing is cool and cool the blood, nourish the heart, and remove the blood stasis and calm the mind. So the whole principle in one sentence replace the warm tonics with mild and cooling herbs. It's still tonified, but without drying the body too much. So I use the dancing, TCM, and the basil, 3 herbs as a group of emperor herbs. This Chinese medicine says, 因为dancing 共同事物, it's one dancing can act as a 事物汤 function, so it's very good. But also it's cooling, good, lower the cholesterol, lower the blood pressure, so it's a very good herb for our modern people. The basil is nourish the blood and soften the liver to soothe the liver's body, and to nourish, soften the liver's body, nourish the yin and blood of liver, and to soothe the liver qi, to have the liver's function, to prevent excessive stress. So this is emperor herbs. Together to tonify the qi and yin, promoting blood circulation and soothing the liver qi, and tonify without excessive dryness. Next, minister herbs. Minister herbs are helping support the emperor herbs to treat the main symptoms. Also can treat what the emperor herbs couldn't treat for the second group of symptoms in a patient. So, Fulin, Yuanzi, and Yu Jing, they enter the spleen and the heart and the liver 3 herbs to keep the whole formula very gentle and moving. 使补中动中有劲，与理气与补液。So this is means try to activate, make the whole prescription like moving, rather than purely tonify, still tonify, and then can cause a stagnation. And the second group of medicine herbs are 莲子、五味子、百合. They nourish the heart, nourish the yin, and strengthen the immune system. So altogether, this formula does 3 things. All this formula does 3 things. Strengthen the qi of the spleen, and nourish the yin and calm the mind. Also nourish the heart to soothe the liver. So over the more than 35 years in the UK, and the CF as next time I will report all my clinical report on patients, because of time limited, only have a couple of minutes left now. So I'll share my cases next time. So the CFS patient offshore the same pattern, heart and spleen deficiency, together with liver qi stagnation and the yin deficiency, and then you can use Dansol TCM. From all these years, I learned a few simple things. I want to share them with you now. First, pattern differentiation always comes first, as Professor Peterson just mentioned. Assess the individual patient, then modify the formula accordingly. Yes, because there's no two patients are same. Just like master, national TCM master Wang Qi saying, there's like all the trees, all the leaves, the hundreds of leaves in the one tree, they're always different. And nothing exactly the same. That is a new model PhD graduate. Dr. Hong Yizhen also is his PhD essays describes that everyone's body constitution, they use different formula that they should eat different food as well. When fatigue present, when there's a fatigue we see the CFS, we have to make differentiation first. So this is the main point. Tonified, but not with too hot herbs, gentle to reach the long-term result and without out of balance too much. Tonified or not over, without overheat. Cool, but without harm, cold the spleen and stomach. Soothe the liver chip and without excessive dryness. 42 years of practice have made me believe one thing, more and more. The strength of Chinese medicine is not in really the classical, we're not in the classical. It is in the following the classic, but use them wisely, always update for today's patients. 26 years ago, my professor, master from Beijing TCM University, gave me written the graphic sent to me. It was, he said, 丝球君子言其所知，要比地道，自比精工。Seek the essence of the classic and extent of what you know. Herbs must be true, and the preparation must be fine. So, 丝球君子言其所知，要比地道，自比精工。Let's remember that words from my master. Now I'm here. I'm ready to pass this message to everyone here, especially like the young generation of TCM practitioners. I wish you a happy TCM journey. Thank you very much.
So Professor Tang gave us her treasure words that she heritage from her master and share with us. Let's say thanks for her effort, for everything she has done for this Congress. Thank you.